Okay, this is the pelvic harness that we're going to be using. We're going to be using it to challenge gait imbalances, posterior sling, anterior sling imbalances, adductors, all kinds of things. So obviously that list is really long, so we're not going to do every single one of them. I'm going to give you some demonstrations that should get your creativity going. But in how to secure this on the patient properly, we did a separate video for that. So go back through the playlist and find the pelvic harness, and that'll get you up to speed on how to do it. So we're going to get started with this, showing you a bunch of different things for multiplanar movements, challenging asymmetrically, symmetrically. It's going to be a good time. Okay, we're continuing with our fall prevention topic. We're focused on some of the research that's out with slumped postures, forward head posture, increasing the risk of falling in the elderly. One of those things that we also tend to see is a lot of pelvic imbalances while they're walking. Some carry way too much anterior tilt, some too much posterior tilt. So we need to strengthen those lower core muscles to help balance out that pelvis area. So this is a great application here. Shows the versatility of the performance station. You can still do this with a spine setup, but the performance station just gives you so much more quick release and variability and things. So go ahead and step back for me just a little bit. So what we're doing right now is with the resistance that's pulling on it right now, it's actually increasing that anterior tilt of the pelvis. And so what this will do is isolate just that pelvis, really help her to engage the lower abdominals, lower core in decreasing that anterior tilt. So go ahead and hands on the hips for me. Good. And go ahead and bring it back. So you can see with our leverage here, we're getting an angle that's trying to increase that anterior tilt. So she's got to fight it with the resistance. And that's a great way. When she first started doing it, she said she felt it really low down here in the lower abs. Some other things you can do to really help out with this is as she comes back, you can tell the client or patient to kind of engage the glutes a little bit, kind of dig those heels into the ground a little bit, engage the core and those glutes, bring it back and get a good contraction that way. Now, again, like some of these other things, you can challenge this and move through multiple planes. So go ahead and take 2 steps to the right. There you go, right there. Now give me a tilt, good. Back to the middle, a tilt, good. All the way to the left, a tilt. Good. Come to the center. Take 1 step back for me. Good. And now do a lunge. There we go. Good. Go ahead and give me that arm swing. Good. And switch again. So we're continuing to challenge. If they've got way too much anterior tilt, we're challenging this through different movements as well. So go ahead and put your hands over your head. Feet wider. Good. Give me a nice squat. Good. And that, some people talk about, I've read so many articles about the wink, okay, for and against it, so I'm not even going to go there because I read a new thing just about every day about it. But if you're big on that, this is something that can help, kind of deal with that by giving that resistance. Again, great tool for warm-up, great tool for kind of getting those synapses firing, getting the mind-muscle connection going before you do lifting or, again, to help a patient who's having trouble with different movements. Now we can go asymmetrical with her, leaving one side hooked up. We can even increase it if we'd like, but it looks like she's getting a good pull there. So you're going to find that when you do this, you're going to recruit the adductors and the opposite side QL pretty significantly. You're really going to feel that relationship between those two muscles. And so she's going to go through this. She's going to do some of her tilts as she's doing it, if that's a component that you need. Again, we're not addressing specific deviations in this person's movement patterns. I'm showing you the examples of these things, taking you through things that are isometric in nature, eccentric and concentric, and multiplanar. Okay, this is all about the application of the product into what you do. So there we are with our asymmetrical things. Now we can add the footwork and different things like that, so we're going to demonstrate that with some of our other products right now. Okay, we're going to be using the pelvic harness while we're doing some stair climbing. Again, challenging balance, challenging pelvic tilts. Obviously, you can turn them around and challenge them the other direction if they have too much tilt in the other direction. Now, I want to demonstrate something here. You see, I'm not going to have her climb all 3. She's just going to do 2. But if we had a situation where we were doing 3, the slastics are rubbing on here. Now we have the protective sleeve that's going to keep everything just fine, but we don't want to put any unnecessary wear and tear on the product. And so just by simply raising that J-hook, I just created enough space rather than having to unhook and reattach everything like on a spine. Okay, so go ahead and climb the stairs. Again, you know, you're coaching for them to keep their neutral posture, not too much pelvic tilt on this, making sure that they're not rotating one way or the other. Once the patient or the client is ready to progress from something like this, then you go ahead and take one of these off, and then you're challenging the pelvis with rotation. So if they have a gait issue when they're walking and they're rotating the pelvis to one side, you can, you know, challenge that accordingly, challenging the systems that you need to challenge through your movement screenings, your diagnosis that you've done. Once you actually put this on, you'll start to feel how this affects these different systems. So again, I don't like to just stay in one plane. That's not real life. So I like to have them move side to side. She could even add a lunge on each side of the steps. And you know, it's great because then your patient is also getting variation in their therapy. It's really challenging them. It's something new each time because you can change it up. And you can get, you know, in my opinion, I get better results with my patients when I start incorporating multiplanar, more real life movement into what I'm doing. And then I get better compliance out of patients, which is so important for getting them better and everything that goes along with that.